Now, though, should dentists be forced to treat NHS patients? Get your calls in 0207 862 2222. The government is proposing a number of changes to fix the broken NHS dental system. And as part of this, newly qualified dentists could be made to work in the NHS for 3 years to bring up the number of appointments available. The new plans would also require dentists to deliver a set amount of urgent and unscheduled care each year and provide more money for complex procedures, which ministers hope will incentivise dentists to take on those more complicated cases. Satisfaction with NHS dentistry has currently fallen to a record low, with more than 1 in 4 adults said to be struggling to access NHS dental care. Would this help you to get the appointment that you're after? And are you sick to the back teeth of shelling out for dental care you can't afford? We're in a crisis, Christian, here. We have dental deserts where actually the areas with the most deprivation are those where it's hardest to find an NHS dentist that you can register with. Something has to be done.
Yeah, look, no one denies that there's a huge problem. I myself I don't think I've ever actually been able to find a free dentist for the 5 years that I've currently lived in my house. It's like really bad, especially in central London. Well, actually, it's worse elsewhere, actually. Yeah. But if it's that bad in central London, then, you know, places like Ashfield or Cornwall, they're really bad. So I don't deny that. My concern is actually this sort of policy could, in fact, put people off going and training to become dentists altogether. If you're saying that once you've spent, you know, all this money on tuition fees and all the years training, that you've then got to go into the NHS where you'll earn a lower salary than if you were in the private sector, that's actually a disincentive.
The starting salaries are actually quite comparable. It's where it goes after that. The starting salaries are typically about 36, 37 grand, regardless of whether it's NHS or private.
It might not just be salary, it might be quantity of work, it might be bureaucracy and stress. There's all sorts of reasons. But actually, the overarching thing we've got to get right is overall pay in the NHS, and that requires a much broader reform of the system. There's a reason that doctors and nurses and dentists and highly qualified people are fleeing to places like Australia and the Middle East because they're paid so much better there, and just trapping them in the NHS for an extra 3 years doesn't deal with the wider problems of supply and demand, which would actually get a grip of the wider NHS issue.
We've got the doctors considering, well, actually say they're going to go out on strike now as well, so that kind of backs up that. I just wonder, Anju, whether this is the solution, or whether after 7 years to qualify as a dentist, I think, with all of that student debt that you rack up after that, you should be at least granted the freedom to make your own choices of where you choose to work.
I, really welcome this conversation. We have given obviously a lot of airtime to the fact that we struggle to get GP appointments, but what's really gone kind of over the radar is the fact that we're struggling with accessing our dental, getting dentist appointments. It has put huge pressure on A&E departments. It's still costing our NHS through the fact that we are unable to see them at the right time, and then we have unnecessary escalation of dental issues that don't need to happen. This is about two things for me. This is about urgency and principle. Young dentists who come out of education, do you know how much it costs to to train individual dentists? About £290,000.
So that's a cost to the country, or to the individual?
How much of that do you think we pay as taxpayers? £200,000 per dentist is what we forfeit in terms of a bill.
So then the dentist takes on 90 grand's worth of
approximately,
debt, or has to be funded somehow.
And then the rest isn't repayable. So I believe, you know, I've grown up in this country where we've seen public service at its prime, you know, at its peak. We do take pride in this country on our public service. We do know that it's struggling. And I think the young generation should really have a cultural shift and invest into that.
You can't tell people to behave a certain way. You have to create structures which make them behave that way. And I'm worried that what Christian says might actually be right here, that if you say to them, look, we have invested all this money in you. Now we will force you to do 3 years. Actually, they'll either choose not to be dentists at all, or they'll take their skills to another country.
I completely disagree with that. Junior doctors, when they finish on their kind of the educational programme, they have to do a couple of years of a foundational programme. They'll get deployed to different parts of the country that are maybe more underserved or where they have the vacancies.
So you not only force them into the NHS, but you make them move to somewhere they might not have considered it in the first place.
This is the perspective around it. On one hand, when you take on NHS care, you take on a breadth of cases. So you actually get experience to more complex cases, those you are likely to less see if you're doing just private work.
That feels like a 10-year training then. You're adding to those 7 years another 3
No,
years
but you know,
of internship.
I completely, utterly disagree. Every single one of us in this country are taking a hit in some way. I don't see this as a hit. I see this as a commitment to public service. When you opt into an industry like healthcare, there should be care in the health.
Okay.
So it's part of a duty of service.
OK. Well, I'd love to feel that all dentists get into it for exactly that reason, but some of them probably look at that debt, don't they, and think, well, you know, I've got to start working on that as soon as possible. Let's take some calls. Frida's in Hertfordshire. Frida, are you registered with an NHS dentist? Have you tried to get registered? What's your situation there in Hertfordshire?
It's not me, it's my niece. They missed her having diabetes, and when they did find out, all of her teeth broke, and now she is unable to find a NHS dentist. And it's just impossible.
The original miss was by the GP, was by her doctor?
Yes.
OK, and then after that, this sounds like one of those complex cases, like a huge remedial case, which, if it was dealt with privately, would be incredibly expensive. Am I right?
Well, they've already given her a quote, and it's over £7,000.
OK, so this is exactly what we're talking about, a complex case where really it's almost, is it unaffordable for you to consider that as private care?
Oh, definitely, yes.
And Frida, can I just ask, what process did you have to go to and what experience did you have to get to this point? Because I'm sure it wasn't as easy as calling up your dentist, right? Did you have to call 111? What did you go through? Because I'm sure it wasn't even a great process to get to this point.
Well, she went through every dentist she could possibly have gone to.
And how wide did you have to spread the net? Have you ever found an NHS dentist, you know, within striking distance that's been willing to take her on?
No, nobody will treat her. They will only treat children free, up to 11 years old.
And how old is your niece?
Oh, she's in her 50s.
OK. How is this affecting her quality of life, Frida?
She can't even eat. It's really bad. She won't go out.
Yeah. I mean, this is the thing, Christian, that we talk about dental care as though, I don't know, we're starting to regard it as a luxury. But what Frida's talking about is actually just being able to sustain an acceptable standard of living.
Yeah, and I do agree with one of the things that you said in particular, which is that if you have the health service collapsing in one area, it increases costs for another area. If you can't go to the GP, you go to A&E. If you can't go to see the GP and then it feeds into some sort of dental crisis, then, you know, the costs across the board are unbelievable and the entire health service it's on its knees. One thing I would raise is that we've been looking at the lower end of the age spectrum, newly qualified dentists. Actually, there's another issue in the NHS, which is retention of older healthcare professionals, which is also a major problem. That's all to do with tax and pension lifetime allowance, which this government is once again going to be considering capping, which could force doctors and dentists who have very large pensions out of the system again. So we've got to look at NHS retention as much as we're looking at new training, and we're getting both of them wrong.
So maybe a scheme where you actually invite dentists who've left the profession back in.
Back in.
OK.
Could also work.
Listen, Frida, thank you so much for your call, and wish you and your niece the best. I hope she gets the treatment that it sounds like she so desperately needs. Susan is in Wiltshire. Susan, what's the situation where you are? Have you tried to get an NHS dentist? Are you in a dental desert?
I've got no problems because I've kept my appointments every 6 months, so I haven't lost my NHS dentist. Also, I'm on pension credit, so I don't get charged. I think that there's lots of young people that would like to become dentists, so I don't understand what the issue is. If there were more available, then we wouldn't be in the situation we're in today. Why not allow them to be trained and see what comes of it? Because there are a lot of people wanting to become dentists.
Well, there are many that want to become dentists because they can see that their pay scale, if they go private, is very healthy, accelerates very quickly. Not so much necessarily.
I'm sorry, Matt, but
Sorry.
I went to Harley Street for implants and what have you, and Harley Street was a quarter of the price of my NHS dentist.
OK.
Because they couldn't do it on the NHS, so it had to be done privately. And as I say, Harley Street was a quarter of the price of my NHS dentist.
Well, Susan, you'll have to give me a number because it sounds like you got the right address in Harley Street. Thanks for your call. Let's take another one. Ben's in Hertfordshire. Ben, what's the situation where you are? Are you registered with an NHS dentist or are you in the profession yourself?
No, I haven't been to a dentist in 25 years. And I've always had bad teeth, or I did as a child. And I have literally pulled all my own teeth out because I couldn't afford to go to a dentist.
Ben, that sounds awful. I'll be honest.
It was awful. It still is awful. And I haven't got any teeth now except for 2 broken teeth on the bottom. And when they hurt, and I just have to put up with it until it goes away.
I mean, Ben, there's no way, we can recommend that kind of action. You're laying yourself open to infection, to all sorts by doing that. What's driven you to take that action?
Because I can't afford. There isn't a dentist to go to anyway. They're all full. And I couldn't afford a private dentist.
OK.
Full stop. I did go to one dentist and I was quoted £400 to pull out a broken tooth and £400 to pull out the second one. And I said, well, I can't afford that. I said, I just have on age pension, I can't afford that.
How many people, Ben, where you live, do you think are in the similar situation that are trying to get that treatment and just don't get it at all?
I wouldn't like to hazard a guess, but I would think many, many thousands.
What would you say about the idea of forcing dentists to do 3 years on the NHS before they move on?
I think it's a very good idea.
Exactly.
A very good idea, because we teach them. No doubt the government paid to teach them, and then they earn vast amounts of money without recuperating it, without helping the people that need it most.
I completely agree with Ben.
Listen, thank you. Thanks, Ben. Thanks for getting in touch and telling your story, gruesome though it is. I hope you do manage to get the treatment you need. I mean, what Anju's saying there, Christian, £200,000 of public money goes into this training. At some point, don't we get the right to ask for something back?
Do you know, I think one of the many problems is that this situation where you've got £200,000 of public investment in this person's education, but they've also taken on £90,000 worth of debt. It's probably the worst of both worlds, because on the one hand, we as the taxpayer feel like you've got an obligation to give back, and the individual dentist, newly qualified dentist, feels they have an obligation on themselves to go and earn as much money as possible to pay off this £90,000 worth of debt. So you'd almost be better either the public subsidising their education to a greater extent, and therefore we do have that right,
off the
or
debt,
they pay more of their own education and then they have the right. But at the moment, it's a catch-22 where both of us are sort of pulling different
I think
objectives.
It's ludicrous. I think we are forgetting the fact that you go into a healthcare profession to look after people, and ultimately, and I say this, if my sister or my brother-in-law listen, they're not going to be happy about it, but especially dentistry in this country has been quite profitable, and it can continue to be, but there is a duty of service, and there's not harm done.
I mean, what's clear from the calls we've had is the amount of suffering and pain that people are in at the moment, desperate to get this treatment, unable to get it. We have to move on. But I just want to mention, I did mention it earlier on, the doctors' strike. It has now been announced that resident doctors will go on strike for 5 continuous days later this month in their dispute over pay. The British Medical Association has said the walkout will begin on the 25th of July until the 30th of July, so that's very soon. Thoughts about that, Anju? Start with you.
You know, I'm always on the... I'd like to think I'm always on the side of wanting to value, again, our healthcare professionals. If I'm being honest, it feels a bit distasteful. We've just had the conversations around nurses going on strike and wanting pay rises. That never landed that well. It's not that long ago since there was some agreement for doctors. Honestly, it feels a bit distasteful in timing. I think the government have given what they can. Do you really need to do that this month? Could it have waited for next year, the year after? It doesn't feel like the right timing.
I think it feels very ungrateful. The junior doctors, they got, I believe it was 22% 10 months ago. 10 months ago, they got 22%. At the start of this year, they were given 5.4%, which was the highest of all public sector workers, and they're still going out. And you would think they'd want to actually sort of try and help Wes Streeting, the Health Secretary. This is a Labour government. They got a huge amount of money last year, and now they're going out for even more, which we can't afford.
I know it's something we're going to be talking about in the forthcoming days, probably across the summer as well. But we have to move on.